Hello, everyone, and welcome to my channel. So, on this channel today, we'll be discussing about cardiac arrest and heart attack. These are two major heart conditions that could lead to death. So, let's go first with cardiac arrest. Cardiac arrest occurs when the heart suddenly stops beating or stop pumping blood throughout the body. The leading cause of sudden cardiac arrest, however, is an abnormal heartbeat, which is also called an arrhythmia. Arrhythmia occurs when the electrical pulses telling the heart to pump blood to the body or throughout the body is disrupted. A cardiac arrest is actually different from heart attack. A heart attack happens when a blockage to an artery stops blood from flowing throughout the various sections of the heart, but does not cause the heart to completely stop beating, as cardiac arrest does. So, the heart attack actually causes blockage, but does not completely stop the heart from beating, as cardiac arrest does. However, having a cardiac arrest can increase a person's risk for sudden cardiac arrest. That means if you have a recurrent heart attack or you have an heart attack, it actually increases your risk of sudden cardiac arrest because a heart attack can cause changes in your heart electrical activities, the arrhythmia that we talked about that can actually lead to sudden cardiac arrest. So it is actually interwoven and interrelated. So when you have a heart attack, it's something, even if it's not as serious as a cardiac arrest, it's something that you should see your doctor about. There are warning signs, or there are some subtle catchy signs of a heart attack that we need to discuss about. The first is that don't wait until you get a heart attack. The warning signs are there. So if you have these warning signs, you should go see a doctor or call the ambulance as soon as possible. Some heart attacks are sudden and intense, but others started slowly with mild pains and discomfort. So you have to pay attention to your body. The first signs, catchy signs or warning signs of heart attack that we want to talk about today is chest discomfort. Most heart attack involves discomfort in the center of your chest. So if you're having chest pain or chest pain in the center of your chest that is lasting for some few minutes and it may go away and then return back, and you feel so uncomfortable, like you're having some pressure in the center of your chest, you're having the squeezing feeling, you're having the fullness feeling in your chest, you should please, as much as possible, is to see a doctor. So another warning sign that we have to talk about that is important is discomfort in some areas of your upper body. That means if you're having neck pain, jaw pain, hand pain, your stomach is hurting, and you don't actually see a cause of it, please try as much as possible to go see a doctor. Because discomfort in the upper part of the body, like the shoulder, the arm, the jaw, the neck, the back, it's been associated with heart attack. Another symptoms that we have to talk about as a third symptom is shortness of breath. So if you don't have asthma or you don't have any respiratory problem and you're having shortness of breath, you can walk a short distance and then you realize that you're catching your breath more often. It has been associated with heart attack. This may occur with or without chest discomfort, so it's something that has to be taken note of. Other signs or warning signs or catchy signs of heart attack include if you're breaking out all of a sudden in sweat, you have nausea, you're feeling fainting, lightheadedness has been associated with heart attack. The symptoms actually varies from men and women. As with men, the most common signs of heart attack has been said to be chest pain, which is called angina or chest discomfort. But in women, they actually experience this atypical symptoms, which is less associated with heart attacks, such as shortness of breath, nausea, back pain, jaw pain. So if a woman is complaining about the jaw pain, the neck pain, it is better to think of heart attack first instead of the conventional chest pain that people complain about. Often cardiac arrest will occur without any warning sign, and this may cause a person to faint or become unconscious. So yes, for heart attack, it's actually very intense. It is sudden. and that needs immediate medical attention. So when it occurs, doesn't give you any warning sign, and this may cause the person to become unresponsive or unconscious. Symptoms of sudden cardiac arrest are immediate and sudden, and this might include the person will suddenly collapse or faint, no pulse, no breathing, there is loss of consciousness. Other signs of cardiac arrest will include racing heartbeats. You're feeling dizzy. You might feel that you have chest pain, shortness of breath, wheezing, nausea, and vomiting. Sudden cardiac arrest is actually a life-threatening emergency, and you should get the person to the hospital as soon as possible, or call the ambulance and get emergency care as soon as possible. Researchers have found out that the most prominent symptoms for women within 24 hours before they have the cardiac arrest is shortness of breath. But for men, it's the chest pain. Chest pain is still the most common presentation, however, for both women and men. This is the symptoms. For the women, like we said, they have the atypical symptoms such as pain in different locations, shortness of breath or fatigue. You can have someone severely complaining about the upper part of their arm actually hurting, or they're having fatigue. It could be heart attack or cardiac arrest. So let's talk about the treatment. The treatment for both the heart attack and then cardiac arrest is emergency treatment. For cardiac arrest, most importantly, it's emergency treatment, which includes cardiopulmonary resuscitation, that's CPR. So if a person suddenly collapses and they're not breathing, that you can't find any pulse on them, please start CPR as soon as possible if you're trained for it. If you're not trained, try as much as possible to give 100 or 120 push on the heart, on the chest, as fast as you can within a minute. But if somebody is trained, they can actually give a rescue breath in between. If they can get them to the hospital as fast as possible, there's something called automated external defibrillator, which will be used to shock the heart to bring the electrical impulses back to life. Survival is possible with fast, appropriate medical care. So cardiac arrest, how deadly it is, if you could get fast medical care and get the person to the hospital as fast as possible, or find somebody to start CPR as early as possible, the survival rate and survival chances actually increases. When to see a doctor? When the heart stops beating, there's lack of oxygen-rich blood that can quickly cause the death and permanent damage to the brain. So when the heart stops, the brain actually suffers most, because the brain will be deprived of blood circulation to it. So call the ambulance, call 911, call an emergency department or emergency services that you have in your area, and get the person to the hospital as soon as possible. If a person is complaining of chest pain or discomfort, you're feeling a pounding heartbeat, you feel that your heart is pounding, there's a rapid or irregular heartbeat, you're feeling that your heartbeat, the way it's beating, is actually irregular, you can't explain why you're wheezing, the shortness of breath. If you walk a few steps and you feel that you're catching your breath on it, yes, you're feeling faint or dizzy, lightheadedness, please try as much as possible to go see the doctor, or go see the doctor and get medical help. This is what I want to talk about today. Please, if you find someone that is complaining about all these warning signs and telltale signs, please get them to the hospital as soon as possible so that they can get the help that they need. Thank you for being with me today. If this is the first time of coming across this channel, please like and subscribe so I'll be able to come out and do more videos for you. Thank you very much. Bye.